What happens during extubation in plastic surgery? Imagine waking up after a long surgery and suddenly feeling your airway is clear and open. That's what extubation is all about. During plastic surgery, the anesthesiologist places a tube called an endotracheal tube into your windpipe to help you breathe while you're under anesthesia. When the surgery is almost over and your body can breathe on its own, the team begins the process of removing this tube, which is called extubation. The first step is making sure you're in the right position, usually sitting up or semi-sitting, to make breathing easier. The anesthesiologist will carefully suction your mouth and the area just above the tube's cuff to clear out saliva and secretions. This helps prevent choking or aspiration of fluids into your lungs. Once the area is clear, they gently deflate the cuff of the tube, which is a small balloon that seals the airway during surgery. Deflating it slowly reduces the risk of injury or trauma to your airway. In many cases, you might be awake or lightly sedated during extubation. This allows you to follow simple commands like taking a deep breath or coughing, which helps clear your airway and ensures you can breathe properly. Sometimes, especially after certain plastic surgery procedures, the team may choose to perform what is called deep extubation, where the tube is removed while you're still under a light level of anesthesia. This can help reduce coughing or movement that might affect delicate surgical areas. Once ready, the tube is smoothly withdrawn while the team watches your breathing closely. They will give you supplemental oxygen right after to keep your oxygen levels steady. Afterward, you'll be moved to a recovery area where medical staff will monitor you for any signs of breathing difficulty, airway swelling, or other issues. They are prepared to reinsert the tube quickly if needed, which is why they keep emergency equipment nearby and skilled personnel ready. Sometimes, before removing the tube, an airway exchange catheter might be inserted. This thin tube acts as a guide for quick reintubation if swelling or other problems make breathing difficult. It can stay in place for up to 3 days as you recover. The entire process is carefully coordinated, considering your specific health condition, the type of surgery you had, and the anesthesia plan. In essence, extubation is a critical step that marks the transition from mechanical support to independent breathing. It involves suctioning, deflating the cuff, removing the tube smoothly, providing oxygen, and vigilant monitoring. The goal is to ensure you wake up safely, breathe comfortably, and recover without complications. Always remember to discuss your specific case with your healthcare team, as individual needs and responses can vary.